This episode of GT the Podcast is supported by Alcon.
This is Ike Ahmed.
And I'm Arsham Shaybani.
And we want to welcome you to GT the Podcast.
We're bringing this to you together with BMC and Glaucoma Today,
to offer audible insights into current topics in glaucoma care.
Presented by the authors of our latest, most read GT articles.
Check it out.
Welcome to GT the Podcast. In this episode, Dr. Catherine Johnson recaps her article, Impact of Selective Laser Trabeculoplasty on Diurnal IOP Fluctuation, which was written with Dr. Barbara Wirostko and featured in the November-December issue of Glaucoma Today. Selective Laser Trabeculoplasty, or SLT, is increasingly considered a viable first-line treatment for open-angle glaucoma and other ocular hypertension. Home tonometry data are shedding light on SLT's effect on IOP spikes in the months following laser treatment. This article reviews diurnal IOP fluctuation before and after SLT and discusses the implications of home tonometry in research. More on this now from Dr. Johnson.
From the early days of their medical training, physicians learn the principle to do no harm and are encouraged to avoid conducting invasive procedures unless they are medically necessary. The default approach is, in the absence of an acute emergency, to rely on medical management first before turning to surgery. Since the advent of selective laser trabeculoplasty, however, the traditional glaucoma treatment paradigm has been shifting. SLT is being established as a viable, if not preferred, first-line treatment for open-angle glaucoma and ocular hypertension. The Laser in Glaucoma and Ocular Hypertension trial is a pivotal study investigating patient outcomes with SLT. 6-year data showed that, compared with IOP-lowering drops, SLT was associated with lower rates of visual field progression, a reduced need for trabeculectomy, and improved scores on the glaucoma symptom scale. SLT is supported by Level 1 evidence as a safe and effective method of IOP control, as well as a more cost-effective and less burdensome option than drops. Determining whether an intervention such as SLT effectively improves IOP, however, can be difficult. For example, if a patient's IOP in the clinic decreases from 24 to 18 millimeters mercury on timolol therapy but continues to spike in the early morning hours, has their IOP control truly improved? In a retrospective study of patients monitoring their IOP with an eye care home remote tonometer, IOP spikes occurred outside standard clinic hours from 8 a.m. till 5 p.m. on 50% of the days assessed. Furthermore, 30% of the self-measured maximum IOP values that patients recorded remotely exceeded their historic maximum values recorded in clinic. Studies have found that a significant association between short-term IOP fluctuation and visual field progression, and have shown that greater diurnal IOP fluctuation is a poor prognostic factor for the development of glaucoma in patients with ocular hypertension. Understanding how SLT affects diurnal fluctuation is therefore an important part of assessing its efficacy. In a study conducted at the Moran Eye Center of the University of Utah, 32 patients monitored their IOP with an eye care home 2 tonometer before and after undergoing SLT. Study eyes, n equals 52, had been diagnosed with open-angle glaucoma or ocular hypertension and were scheduled for a 360-degree SLT procedure. Within 4 months of their scheduled SLT, patients monitored their IOP for 7 consecutive days at 6 targeted times, namely 6 a.m., 9 a.m., noon, 3 p.m., 6 p.m., and 9 p.m. After SLT, patients repeated the 7 days of measurements at the postoperative 6-week, 3-month, and 6-month time points. IOP-lowering drop regimens remained consistent throughout the study, and a post-SLT regimen of NSAIDs dosed 4 times daily for 4 days was prescribed. Pre- and post-SLT IOP measurements were compared with respect to the maximum, minimum, mean, range, and standard deviation of measurements taken during that 7-day period. Overall, SLT resulted in a significantly lower maximum IOP, mean IOP, IOP range, and IOP standard deviation compared to baseline through 6 months postoperatively. Compared with baseline measurements, at 6 months on average, the mean IOP decreased by 1.6 millimeters mercury at the 90% confidence interval, negative 2.2 to negative 1.1, and the maximum IOP decreased by 3.4 millimeters mercury. The IOP range decreased by 2.3 millimeters mercury, and a standard deviation decreased by 0.48. These findings corroborate those of prior studies observing a reduction in IOP fluctuation after SLT, and they show a sustained IOP lowering effect with SLT, supporting the light trial outcomes. Collection of 12-month post-SLT data is underway to determine whether this significant effect persists and when a repeat SLT procedure may be warranted. The majority, or 83%, of pre-SLT IOP spikes that occurred in the Moran study, representing the maximum IOP value measured over the 7-day period, were recorded outside standard clinic hours. This trend was also observed by McGlumphy et al. Study and suggests that a full picture of patients' IOP fluctuation is not completely captured in the clinic. The literature shows that the eye care home is relatively easy to use, with studies reporting that with brief training, 73 to 94% of patients were able to take precise measurements. In our study, 96% of patients were able to use the eye care home 2 successfully. Ultimately, home tonometry devices pave the way for myriad studies that can help guide glaucoma providers. For example, by monitoring IOP fluctuations perioperatively and after various surgical procedures. These studies could benefit providers and patients by offering more immediate and tangible feedback on whether an intervention is successful and providing perspective on how to mitigate future disease progression. In conclusion, SLT significantly reduces common parameters of IOP fluctuation for at least 6 months post-operatively, reinforcing the findings from the light trial that support the use of SLT as a first-line treatment for glaucoma. Home tonometers, such as the Eye Care Home 2, can provide valuable information on IOP fluctuation before and after SLT. Lastly, I would like to add that this study has been a huge collaborative effort from our Moran Eye Center glaucoma doctors, including Craig Chaya, Austin Nakatsuka, Norm Zabriskie, Rachel Simpson, Susan Chorkov, Ike Ahmed, and Barbara Wirostko, as well as ophthalmology residents and staff. We're looking forward to wrapping up our 12-month post-op data next month and then seeing to what extent these trends continue.
Thank you for tuning into this episode of GT the Podcast. If you have any feedback or topic suggestions, find us on Instagram, LinkedIn, Facebook, or Twitter. And stay tuned for more hot topics in glaucoma care on GT the Podcast.